Welcome to India Next and Time 24 into 7. My name is Sahitya. Today I'm extremely honored to have Dr. J.P. Narayan Garu with us, who is a leader who worked at the intersection of the governance, public health, and agriculture. He is also a true crusader for a corruptionless society, governance, and democratic values. As a wellness care provider from the common grounds, I'm eager to explore with him some of the blind spots between what we grow and what truly nourishes India. Okay. Sir, you have seen the government, or you have seen the system from the inside as an officer and also from the outside as a reformer. What do you think is the actual real constraint? Is it the political, bureaucratic, economic? Is it the lack of will, or is it a capacity, or is it the system impunity by itself?
It's a combination of many things because we are still in early stages of.
Interesting. So Europe, so that answers to my question. So how do you compare with the current um, healthcare governance from India to other countries?
Before coming to that, and somewhat aligned to that an issue, even poorer countries, when they make efforts, they're actually making very significant progress. Take turmeric. Indian subcontinent probably is the greatest consumer of turmeric, what we call pasupu in Telugu.
Yes.
It has a lot of sacred significance. Some people say a lot of value in terms of human
Antifungal,
health, all
antibacterial.
kinds of things. Some people question that, but that's immaterial.
Right.
And we are certainly the biggest consumers in almost everything. In turmeric, all kinds of additives, lead additives are added in order to give that rich color, turmeric color, that rich yellow color. And lead is a deadly thing.
It's a poison.
It's poison, and millions of children are affected because their growth and development of the body and the brain in particular are affected. Very serious problem. It's not just another additive or another contaminant. It is a deadly contaminant. What is Bangladesh doing? Bangladesh is a poor country with a per capita income lower than ours. And Sheikh Hasina's government, and we all know now, Sheikh Hasina's government was not a model in some respects, but even such a government had the determination and the political will to root out adulteration of turmeric in Bangladesh. India was not doing that job. Some time ago, I read a piece in The Economist. I was deeply troubled. Then we got a few samples of turmeric in Hyderabad to see if indeed there is a major problem. In those particular samples, we didn't seem to find a problem because the lab results were showing that there was no contaminant. But if globally the literature says there's a lot of contamination of turmeric in India, I presume it is there. And it's causing immense damage. If Bangladesh can do it, why can't we do it? So, to go back to your bigger question of health, that gives us an answer. Yes, we are relatively poor. Yes, we cannot spend 10% of GDP on healthcare, which is what most of the rich countries spend. America spends 18% of GDP, not necessarily all government, half of it government, half of it private sector through insurance. We can't spend that. Our government spends only about 1% of GDP. Our total expenditure in the country on healthcare by the government and the people in various forms is probably about 4% or more. Government's claim it's coming down. I don't believe it's coming down, but probably 4.3% may be accurate.
But sir, is it in spite of having one of the most, India is having one of the most qualified healthcare professionals?
No, that's right. The issue in healthcare is we have some great strengths, we have some glaring weaknesses. Let's focus on the strengths. As I said, we have no problem of human resources, doctors, nurses. We produce 120,000 doctors a year, hundreds of thousands of nurses, and all kinds of healthcare professionals. And if you want more, like a tap, just switch on the tap and you get more. More colleges, more institutions, this, that.
But quality fueling them again is
quality is questionable. Training is not always good, but we can improve that. The demand is good. It's not a problem that's insurmountable.
Okay.
True, our pharma industry is a world champion. We produce the world's best quality drugs at the lowest price. Our vaccine industry is a world champion. 3, the high-end interventions in private sector in healthcare, a kidney transplantation or a knee transplantation or a coronary bypass surgery or something else, we do it at world-class standards at the lowest cost in the world. We are an envy of the world. Therefore, in some areas, government does a good job. Vaccination, we are pretty good. Indradhanush and other areas, 12 or 14 vaccines are given to children, and we're very good.
Very good.
Universal
Okay.
coverage and the cold storage chain is impressive in government. Government is generally inefficient, and we all know there's a lot of corruption, but this is an area where we do pretty well. And of late, there is some political attention paid to healthcare, not necessarily in the right way. It's always with an eye on the vote rather than improving the health, but certainly some of it is positive. These are the positives. What are the negatives? Government expenditure is too low. We're only spending about 1.3% of GDP on healthcare, the lowest in G20 countries, lowest in any significant economy in the world. Out-of-pocket expenditure, while we're claiming it's coming down, still it is high. Now, the numbers can be disputed. It used to be 58-60%. Government now says it's closer to 40%. I think it's still about 50%.
Okay.
Common sense and anecdotal evidence tells us. But even if it's 40%, it is much too high. As a result, about 50 to 60 million people every year are descending into poverty because of healthcare problems. At the beginning of the year, they were not poor. But by the end of the year, because of healthcare challenges, either because of ill health, they could not make enough money, or they had to sell their assets
Okay.
and give away money that's necessary for the other needs, or borrowed very heavily. And therefore, they're descending into poverty because of healthcare challenges. 50 to 60 million, 5 or 6 crore people in a year, which is an incredible number. An incredible number. A primary healthcare system is generally very weak, except no immunization. And it's always the primary healthcare system is the gatekeeper of the health of the people. If that is bad, all the sophisticated things you do in big hospitals, they will not help you much. And our government interventions, the recent interventions with increasing interest in healthcare, like for instance, Aragyasri in Andhra Pradesh and Telangana, it started in Telugu states. And now the PM Ayush and some other programs at the national level, they focus essentially on the hospital care, surgical interventions rather than the primary care. Now,
Right.
the good fortune is with very limited expenditure, we don't have to spend 9%, 10% like in Europe and America from the government. With a limited expenditure, but definitely we have to spend more money, but wisely spent with proper primary care system, with competition and choice as the key ingredients, with public and private partnership together, we can significantly improve healthcare outcomes. Otherwise, what's happening now is there is a measure called disability adjusted life years.
Okay.
That means out of 1 lakh people, 1 lakh population, in 1 year, for whatever reason, maybe old age, maybe an accident, maybe death in an accident or death prematurely, maybe because of illness you're not able to work effectively. How many life years are you losing? India has an unacceptably high number, 39,000 years per 100,000 population. That means
Oh.
for some 20,000 years you cannot save because elderly people, very severely ill, sick people, or premature deaths, etc. But at least 15, 20,000 years we can save. They're all preventable problems or treatable problems because they're not addressed adequately. A healthy person is facing disability. And that means to that extent your productivity is down, your growth potential is down as a country, and your GDP growth is stopping, and you're wallowing in poverty. So we can easily address that with in fact, FTR Lok Satta we have designed one viable model. It's not that there's only one answer. We can improve that, but the basic ingredients are commonsensical based on evidence and practices all over the world. Strengthen the primary healthcare system, make it effective and accountable. Have a proper referral system. Strengthen the hospital care system based on the existing platform,
Yes.
PM Ayush and Aragyasri. There are some blemishes we can easily overcome.
Okay.
Improve the tertiary care, high-end tertiary care in the publicly funded teaching hospitals. Otherwise, what
The
will happen
tertiary
is,
care. Okay.
because tertiary care is very complex and costly. Health technologies, that every day new technologies are coming. The costs are plummeting, dramatically rising. For instance, recently in the UK, they found gene therapy for thalassemia. Now, you can actually cure a person with thalassemia.
Oh.
It only costs £1 million. That is about 10 crore rupees. There are some other interventions which don't actually cure. They say, just spend another crore rupees, maybe it will do some good. So healthcare, unless you're very careful about the high-end care, costs go up, the benefits don't really match. And in a poor country or even rich countries, for the same money you spend, what is the best value you give to the people in terms of better health, saving lives, prolonging life, and so on and so forth? Otherwise, there's nothing like ideal healthcare. There's nothing like best healthcare.
Yes, healthcare.
These are the resources: human, money, material, technology. These are the problems. With what's available, what's the best you can get? If you don't look at it that way, you get very little. So tertiary care must be very carefully monitored. So there are ways of doing it. The world is doing it. Singapore has a fantastic healthcare system. Doesn't spend too much money. Government spends only about 3.5% of GDP, the lowest amount among rich countries. But it has the best healthcare outcomes in the world. So we can learn from other countries and build a model. And I think if all of us understand a little bit more about what needs to be done in healthcare, leveraging our strengths without too much of additional expenditure, because government cannot afford too much money. We are still a poor country. There is so much need for government expenditure in infrastructure, in quality education. Of course, healthcare needs money. Many other areas need money. So there are too many demands on the public money. So you can't simply say, give me another 10 lakh crores. It's absurd. It will not happen.
Yes.
But with the limited money, we can do a lot.
Well, very insightful. Very, very insightful, Doctor. I learned a lot in this duration of 20 minutes, maybe. And I think I will learn even more. And so I think you answered most of my questions that speaks about the quality and also the cost and all that. So I have a few rapid round questions. So you can choose A or B. So the first one will be: punish one corrupt officer who allows adulterated oil to be sold. B. Install one public food testing lab in every district.
The first one is tempting, but the second one is actually more effective. Because in a system of ubiquitous corruption and inefficiency, punishing one fellow will assuage our feelings for the time being. It doesn't change much. The issue is availability of technology and regular proper testing with effective monitoring and with public information transparency. For instance, some years ago, our Lok Sabha team collected samples of drinking water from various pockets of Hyderabad and we tested. We found that a large number of samples were inedible. They're not portable. That was in the backdrop of, in Kerala or someplace else, one of the Coca-Cola thumbs up companies, Coca-Cola, I think one of the organizations did survey and found that the water is not good. It's not the Coca-Cola company's fault. It's the input water itself is bad.
It's not portable.
So then we decided, let's test it. So if this is widely known, you actually test it and it's widely known. Public, sometimes even civil society organizations, even if the public facility is available, we can go, we can test it, we can pay the price if necessary and make it public. Then the public pressure will mount. Then the governments and administration cannot escape. Therefore, access of technology and information are more important than punishing one or two fellows. Though it's very tempting, we're all angry. We want to punish fellows. But we must get results for the people.
This is in the interest of understanding. If we can fix, if we want to follow a particular set of rules, we need to be fearful of certain things. So I'm sure, like you said, point B would be more effective and long standing, and we would also come up with more and more, findings or protocols to get this done in every district. Yeah. Next one, A is ensure farmers get 50% more for their nutritious crops. B, ensure consumers pay 30% less for eggs and fruits.
A. B is about state intervention and control.
Okay.
Control and state intervention lead to corruption and shortages. A. If there is a need for a certain commodity, food or non-food, the demand must be manifest. What is the best way of manifesting demand? Price. If price is ensured by whatever means, either because of market demand or government intervention in the form of MSP or whatever, then supply is ensured. Once supply is there with public education, you can actually change the food habits. Otherwise,
Right.
it's like our Essential Commodities Act. I go black marketing, I permit black marketing, rationing, corruption, no outcomes.
Right. But sir, what about the processes the between that comes from the farmer to the plate? There's a lot of nutritional deterioration that happens at every stage. So how can we overcome that in that case?
It's a great question. There are actually two elements to this. From farmer to the plate, even if there is no much processing involved, farmer gets X rupees, the consumer ends up paying 4X rupees. There's a long market chain. There are typically about 6 intermediaries, and they're not bad people. We use the word intermediaries or middlemen as a bad word. No, they're necessary.
Necessary,
But the
yes.
system is inefficient. It's on low volumes and high margins. What you should do is go for high volumes and low margins. It's called compressing the market chain. Instead of 6 intermediaries, supposing all the 6 functions are performed by one chain,
Mm-hmm.
after harvesting, for instance, grading, packaging, transport, storage, retailing, processing where required, opening up global markets. Supposing one, let's say Walmart chain, a Carrefour, a Tesco, or Reliance, or somebody, I don't care who. Suppose they do it scientifically and well. The profit margins are low, volumes are great, and typically the farmer gets about 70% of what the end user gets, pays. That is one part. The leakage is that. The second is in processing from, as I said, farm to plate, the kind of distortions that we're going through because of the processing, either because of bad technologies or because you're only profit driven, you don't care what happens to the people's health.
Right.
Therefore, either to preserve the food for longer to get profits or to make it more tasty even if the health is ruined, you're messing up the foods. And there, a combination of public education, and awareness, the kind of work you're trying to do. So, Sahitya, the effective and honest regulation across the board, not in a few, you mentioned about testing labs, but a lab everywhere and effective regulation. Our regulation is corrupt, inefficient, and inadequate, all three. It's not merely corruption. We just don't have enough public infrastructure to be able to regulate effectively. So a regulator, if the moment you create a law and they create an inspector, that became a profit center for them. And we keep hearing about even low-level regulators making tons of money, crores and crores of rupees money. We must completely change that and therefore make it very transparent and make it also accessible to the non-profit organizations and expert bodies and people who are concerned in this sector. There are many people like you. And if you fight for that, and you get the results, because we will be operating. It's not the government alone that's operating. You treat citizens as sentinels of their own health and their own freedom. There are innovative mechanisms of making that happen. So if you do both, public education on the one hand and effective regulation with citizens' participation on the other hand, as long as the supply is available by giving an incentive, things will definitely improve.
Very interesting. Thank you so much for all this information, sir. The next one is strict weekly checks on big food company factories. B. Empower local women's group to audit ration shops and kiranas.
This is a bit more dicey. Both appear appealing, both have some limitations. Because of the increasing power of the big industry,
Mm.
I would say, and also because the relative ease, relative simplicity of handling the large volume and large turnover big companies, I would say with our limited governance capability, um, strict weekly checks on big food companies, but subject to again the caveat that our inspectors checking don't collect big mamuls from the big fellows,
Yes,
as long as we
yes.
enforce that. Given India's current conditions, maybe that's the way forward because, my God, the way the fast food industry is growing in the country and big chains are growing. And I think we cannot stop it. It's inevitable. Our like and dislike doesn't matter at all. That's the way the world moves. That's also an efficient way of doing it. So it's easier to regulate, and I think that's where the focus should be to start with.
The next one is a strict law for honest ingredient quality labels on front of pack, 10 times more funding for public food testing laboratories.
I think both are required here. Laboratories we already covered, therefore I will not
Yes,
cite that. Because by definition, the big players, they want to comply with the letter of the law, not the spirit of the law. Therefore, if the law actually encompasses the requirements, if it's very judiciously made, then the big companies tend to comply with them.
right.
You take the ORSL, for instance, the law is
Yes,
really effectively made. They are unlikely to violate the law. If the law is loose, if there is a way of getting away, then they will happily violate the law because they have a lot more to lose by violating the law. It's not merely that day's profit. So I would say when dealing with big companies, very strict adherence to standards. First, stipulation of the standards, adherence to the standards, and making the law or the regulations very tight will certainly help. And enforcement will generally be easier in case of the big global giants.
right. So now, after this ORSL episode that has happened, now every parent is thinking, I mean, we are thinking twice about the FSSAI licensed label that is being there on the
No,
food
some
labels.
simple things people should know also, Sahitya. In Coca-Cola and Thumbs Up, I have nothing against them. I'm mentioning names so that
Right,
people
right.
understand. It is shocking to realize that the sugar content is tens of grams in each can.
Oh,
Now, in ORS, for instance, you must not give more than 13.5 grams per liter. Per liter.
per liter. Yes.
13.5 grams is something like about 3 or so not tablespoon, but teaspoons. Small teaspoons, you know? No more than about 3 teaspoonfuls for 1 liter. 1 liter. And imagine 10 times, 20 times being added. So, first of all, it's not merely labeling. Certainly, that's very important.
Yes.
Regulator must do their job.
Yes.
We
Yes.
also must be better informed. Just because it's sweet, don't think it's good. And even other commodities, you know, soft drinks, they're deadly. When one of our sports stars, Pullalu Gopichan, some 10, 15 years ago, when he won the All England badminton champion, when one of these companies asked me to endorse these soft drinks, he said, no, I will not ruin the adolescents and children's health by endorsing that product. I felt very proud about it.
That's lovely. Yes.
So, uh, first, the families and the people and the viewers, they must understand certain basics. You may not be very proficient and you may not be experts in that. But the amount of sugar involved in these things, 100 grams of sugar means 400 calories. That's 1/5 or 1/4 of the total food intake that day, the calorie intake that day. If only one dose of sugar through one drink is fulfilling that need, my God, what's happening to you?
The whole point of rehydration is lost.
Dehydration and nutrition,
Yes.
liver is gone, your cholesterol is increasing, your diabetes is coming, everything wrong is happening in your life. It's a passport to ill health and passport to early demise.
So, who exactly is accountable for this?
There's no point blaming XYZ.
Hmm.
Corporate greed is a central issue. But then what did government do? Government didn't pay attention. When they pay attention, there's too much of corruption. Then what did the consumer do? Consumers are reckless. They're not taking minimal steps to protect themselves and their children. So all of us must pay responsibility because blaming XYZ doesn't help. At the end of the day, if I am consuming, I must also be willing to take some responsibility. And all of us must really propagate in practical terms in ways that they can easily understand, not in complex technical terms. For instance, how many people understand that there is a Food Safety and Standards Authority of India Limited? I mean, it's very
Yes.
difficult to comprehend.
Yes. Yes.
So
Yes.
we must bring that in a very relevant manner, an accessible manner to people, what it actually means, and what are the minimum things you should look for, and how should you make sure that you're not fleeced. And if you're in doubt, now with modern technology, instead of wasting time on stupid WhatsApp things, you actually do some research with the digital technology. In 1 minute, you get it in whatever language you want, and you can get better and better. Or consult
Yes.
people like Sahitya who know better. So let's educate people and empower them. That will make enormous difference.
Certainly, sir, certainly. And another thing that I would like to talk about is the RO purifiers, RO water purifiers. They're very expensive. Today, only higher middle income group and higher income group have these RO water purifiers installed, and it's vice. I mean, it's the other way, right? So, what about the lower income groups? Pure water is a
We
very
are a,
big.
we are a unique economy because of the government's colossal failure in providing basic amenities of quality, water supply, proper sewerage system, mosquito control, air quality,
Air
etc. What's
quality.
happening? Air purifier. Actually, I was telling my team, uh, just look at the literature and see if it's necessary. At least I need to protect your health. Let's have air purifiers. I feel compelled because whenever I check on the mobile phone what is the air quality at this point of time, I thought only Delhi had the problem, but I just realized Hyderabad has the problem too.
Hyderabad. Yes, yes,
Similarly, water. Each of us, me included, we have AquaGuard or some other form of water purifier.
yes.
Mosquito. A whole new economy has come about, all out, all night, this, that, I don't remember what are the names, but a whole new economy came about. So governmental failure is actually boosting the economy in a very peculiar way. It does not improve the quality of life, but GDP is going up. Like, when a disaster strikes, GDP actually goes up because then you start repairing. The loss of disaster you don't count, but the money spent and the work done to repair the damage you count. So GDP calculations are a bit, in some respects, somewhat dysfunctional. So these are adding to the GDP, but they are diminishing the quality of life. It's a fundamental failure of governance. Fundamental failure of
Failure.
governance. Take mosquito control. Now, no matter how careful we are, and I'm very careful, I'm a doctor and I'm also careful about my health.
Absolutely. Absolutely.
Everybody wants to protect their health. But my wife and I got chikungunya last year
Oh,
because no matter how much care you take, you cannot prevent every mosquito from entering the home, or you cannot prevent a mosquito biting you somewhere outside.
yes. We cannot prevent ourselves from going out.
And chikungunya is one of the most painful conditions. And my wife actually had a long lasting one, not merely for a few weeks, but it had impact a little longer.
Oh,
So you cannot control mosquitoes through individual efforts alone. It has to be collective. Collective means a strong and effective local government accountable to people and consensus. Are our local governments doing that? Our roads are pockmarked. When there is a bit of a rainfall, there's a flood there because stormwater drainage is a mess. Sewerage is so in such disrepair that sewage often
is
gets
open.
contaminated, water gets contaminated with the sewage. 40% of the water that's coming to Hyderabad city, we are spending thousands of crores of rupees to pump water from Krishna and Godavari. We are lucky to have two great rivers flanking this great city. 40% of the water is going into Musi without reaching homes. Mosquitoes are a menace everywhere. This is not governance. Unless it's a locally accountable issue, very transparently, we cannot improve this. In the absence of this, what are we doing? People are seeking short term free things, free power, free water, free bad water, but free water.
Free water. Yes.
Then free rice, free something, rather than what the government should be doing, the collective needs of society to preserve our health and sometimes our life. And people are seeking other options, whatever they can do, because you have to survive. I have to
Yes.
get if I want to sleep, I have to have an all night. If I go out into field, if I stay in a hotel room or in some other place, if the mosquitoes are on, what do? I can't talk of theories. I have to protect myself from mosquitoes at night. So I use all night or whatever is available. So I used water with only AquaGuard or with. So this is survival. And this survival is forced on the people by absolutely substandard governance. And that is happening because we have completely forgotten what government is about. Government is about fulfilling our collective needs which we cannot fulfill ourselves, which are necessary for the quality of our life. And they'll be largely delivered only at the local level. There's no national thing. There's no Bharat Mata there. There's your ward, this apartment. We all pay monthly maintenance.
Yes.
Now, if the lift doesn't function, immediately I holler because I know exactly why I paid the money. Exactly why I elected somebody as a member of the team to manage the affairs here. That is when governance works.
Yes.
And
Okay.
we have failed to do that. We centralized government. We distorted politics. Everything is reduced to money power in elections, how much money you give to the voter. And what actually should happen in the form of governance is completely neglected. And in the process, our health is ruined, our nutrition is ruined, our quality of life is ruined. It is high time we rediscover governance and fight for that. No quality of traffic in Hyderabad city, for instance. When you come here, the amount of traffic snarls and the pollution, the air quality in Hyderabad, for instance, or any city for that matter. So it's high time that we went back to basics. It's not about political power games. Who is in power? Who is the chief minister? Which party? Which caste? It's irrelevant to our lives. The only thing that matters is what's happening to us and our children. So we must bring governance back to that.
Very insightful. Yes, definitely. We are all forgetting that we have a government that needs to take care of us. But we forgetting that, and we are just in the process of trying to survive, and we look for other alternatives, and also feeding
Mhm.
the comfort levels for all the systems. Another thing that I would like to now, after this conversation, supposing one of the viewer feels angry. Now, you just spoke about, we just had a discussion about the turmeric, the lead content that has adulterated the turmeric, and it has been distributed. And so there is a viewer who feels helpless. What do you think should every citizen of India, or at least whoever is listening, should do to fight for better food in that locality?
I would say there's a general prescription, and that is collective, informed assertion.
Collective informed
Assertion.
assertion.
Now, individually, we can do only this much. So, organize into groups, like-minded groups in an apartment complex, a ward, locality, with a problem which perceive together. Equip ourselves with knowledge. That's what you're trying to do. As much as possible, let's know what is the way of getting it done. And let us find innovative techniques of setting it right. Can we come together and collect some samples and test them and make it public so that public will be raising voice? Can we find viable solutions and then propagate that particular thing? I'll give you an example in the non-food sector. A movement started in Hyderabad in 1998, which had profound and positive consequences. In those days, in petrol bunks, about 10% short delivery used to be there. You feel that you are told that your tank uh, was delivered about 30 liters. Meter is showing that, but you only got 25 or 27 liters. It's habitual. 95% of the petrol stations, they cheated the customer. We were all unhappy, angry, we didn't know what to do. What did we do in Lok Satta? It was a problem known, even I knew it. As an officer, as a citizen, both. But we didn't know how to address it. As an officer, we were inspecting, checking, seizing, sometimes punishing, but it was not really changing much. We understood one simple thing. That's where informed knowledge is important. That the citizen has the right to ask the petrol bunk to fill a container. They can say, please fill this bottle or this, some other container which is pre-calibrated for us, 1 liter, 5 liters, 10 liters. The moment I know it is 1 liter or 5 liters here, I see the meter, the game is up. If the meter shows 5 liters, but I only get 4 liters here, it's not sustainable, right?
Absolutely.
Very simple, elegant solution because we're informed, we're empowered. Then what did we do on 2nd of October 1998? We all went around Hyderabad, a few hundred of us, young people mostly. I was the old man at that time, not as old as today, but definitely uh, we donned some nice coats and had some caps. And we took these cans, which were already pre-calibrated. The volume is known.
Okay.
So we gave money to the petrol bunks. So please fill this can. Within 15 days, all the petrol bunks, the meters were set right. In all of
That's
Andhra Pradesh,
fantastic.
1,500 petrol bunks. And very soon, the oil companies, which are public sector companies, they woke up. They said, why are we keeping quiet? So far, we didn't bother. Now people are awake. So let us now have tamper-proof meters. So they changed the metering system all over the country. Now short delivery is very little. It's probably never zero, but very, very little. You know how much the consumers have gained since then? Sahitya, every year, the people of India are gaining on account of that one work 1 lakh crores per year.
Oh my God.
About 300 crores per day.
That's very, very huge.
So what is the effort made? Very little. So collective, informed assertion. All of us, our role is to understand better, because everybody doesn't have the time or energy or opportunity to understand better, to get the technical knowledge, etc., or legal knowledge, and propagate, spread, and to the extent possible, publicly or privately build infrastructure to make it easy. Supposing I want to test samples of some crops to see pesticide residue is there or not. I want to test whether lead poisoning is there in turmeric or not. Somebody who has the time and some money, or together collectively, they must be able to go there and get it done. So give knowledge and improve the public infrastructure to the extent possible. Rest of it, automatically people will, because it's about us. It's about our lives. Who doesn't want a better life? Who wants to be poisoned?
Certainly.
So this is, in my opinion, if we do it rightly, right now with the current technology and resources, it's an easy problem comparatively. Because this is not something where people don't realize the link between what you do and what happens to you. If you say, no, Bharat Mahan Hoga, do something wonderful, it's all okay, slogan, but how is it touching my life? Whereas here, it's touching your life. Traffic on the roads is touching you today. The food you eat and your children eat, touching you today. So if you actually do it right, these are somewhat easy problems to mobilize the people.
Sir, if you come to power, what would be the policy that would evolve the current status of nutritional crisis, especially the nutritional bankruptcy and food security?
We must completely revamp the public distribution system and procurement first from the supply side. It's not going to be easy, but it's necessary. The minimum support price, which is above market price for rice and wheat, which are already oversupplied, overeaten, causing ill health, must be given up. Instead, if you want minimum support price, give it for pulses. India is importing about 7 million tons of pulses.
Okay.
India exporting about $5 billion of roughly equal value, $5 billion worth of meat, mostly beef. Beef, anyway, we don't eat. I'm happy because no, if somebody is eating that, we have plenty of buffaloes in the country. We are the largest repository of buffaloes in the world. But the point is, we don't have to import, because most Indians are vegetarian. You may not be vegetarian strictly, but most Indian food is vegetarian.
Predominantly
non-vegetarians, 90% of the food is vegetarian. Only once in a week or so they eat meat or something else. So unless the dal production improves, and unless along with production, you make it an integral part of the public distribution system, not your rice and wheat, remove that. Put these things which are really necessary. And unless we educate the public on a mass scale, because food markets work in India. Unlike other countries, food markets work. Food reaches Himalayas, it reaches islands like Lakshadweep, etc., Andamans, it reaches remote villages, it reaches everywhere. Market is not a problem. Supply is the problem, affordability is the problem, knowledge is the problem. So handle supply, affordability, knowledge. Supply by giving incentives to farmer to produce more of the necessary commodities rather than unnecessary commodities. Affordability, if there's a problem, put money into their pockets, or have public distribution, which actually caters to the real needs.
Right.
And public education. Once they know that this is the kind of food they should eat, not merely more sugar, more carbohydrate, it doesn't really help, then I'm absolutely certain 99% of the problem is solved. Yes, there may be odd people who still have odd kind of food habits.
Yes.
We'll try and deal with them. And in line with that, wherever government actually is giving food, particularly to the vulnerable children, midday meal program, your Anganwadis, etc., fortify your foods, strengthen your food distribution system, keeping in mind the nutritional needs. So once you do that, and all this is doable at a relatively low cost, it doesn't cost much money. You have to reorder your priorities and have a relentless goal. But ultimately, governance is about our people's health. It's about their nutrition. It's about wholesome development as children, from children to adulthood. If that governance does not focus on that, what is the point of governance? Is it not about some king coming and dominating us and making money?
Absolutely. Thank you so much for your time, sir. And you have elaborately discussed about various problems, and you've almost answered most of my questions in one go, in fact. Thank you so much for your time. So, viewers, from this insightful discussion, I hope you had all your questions answered. So, please like, share, and subscribe, and comment down below on what is the first action that you would like to take for providing better food in your locality. Thank you.
షేర్ చేయండి, లైక్ చేయండి, సబ్స్క్రైబ్ చేయండి. మరిన్ని వీడియోల కోసం బెల్ సింబల్పై క్లిక్ చేయండి.